Both of the presenters coming up in the next succession will, I think, talk further about protective factors and the power of culture. So our second presentation will profile what, for all of us who work in this area, is an important guiding model for American Indian and Alaska Native suicide prevention efforts, the Celebrating Life program of the White Mountain Apache community. Our co-presenters will be Novalene Goklish and Francine Lazarow. And I want to welcome you, Novalene and Francine, and turn the presentation over to you.
Good morning. Thank you. So my name is Novalene Goklish. I'm a member of the White Mountain Apache tribe. I reside here on the Fort Apache Indian Reservation. I've been employed with Hopkins for a little over 25 years, and I oversee all of our behavioral health programs with support from Francine. I'll allow her to introduce herself as well.
Good morning. My name is Francine Lazarow. I'm also a member of the White Mountain Apache tribe. I have been employed with Johns Hopkins for 18 years, and I'm a senior research associate. Good morning. Thank you for having us.
Yes, thank you so much for inviting us to be a part of this presentation and to share the work that we're doing. And so to start, our tribe, we've experienced, suicide, death by suicides for a few years. So when we were in high school, Francine and I, that's when we finally, were exposed to what suicide was. We had one of our classmates die by suicide. And at that moment, we didn't even know what had really happened. And so it was a shock for us to learn that he had taken his own life. And moving forward, in the early 90s, our tribe was trying to figure out what was going on. The work that we were going to be doing is based off of the things that had happened, when we were in high school and thereafter. And so if we could go ahead and, move to the next slide. And so we are based in Arizona. Our reservation is 1.6 million acres. We have over 17,500 enrolled tribal members. We have about 13,000 or a little over that reside on the reservation. We are geographically isolated. It takes about 3 hours, maybe 4 hours to get to Phoenix, about 4 hours to get to Albuquerque. And so we are, up in the White Mountains. We live so when you think about Arizona, a lot of people think about the desert. And so for us, our reservation is mountain-based. You see different, the terrain changes depending on where you're going throughout the reservation. And so we do experience the 4 seasons. We also have a ski resort on the reservation. There's a lot of lakes and streams that, so we're blessed with very beautiful land. And then we still, practice our tradition and culture, participate in a lot of our ceremonies. We are governed by our tribal council, which consists of 11 delegates, our tribal chairman, and then our tribal vice chairman, and then we have 9 council delegates that oversee 4 districts. And then our tribe has been working in partnership with Johns Hopkins University Center for American Indian Health for over 40 years. And so we'll go ahead and proceed to the next slide. And so prior to the 1950s, there were very low rates of suicide. And in the 90s is when we started to see the uptick in death by suicides, mainly in youth. And so our tribe reached out to Johns Hopkins University to ask for assistance to try to better understand what was happening with the suicide attempts and the death by suicides. And so in 1993, the tribe invited the behavioral health component of Johns Hopkins to come out and to do some qualitative interviews with community members, tribal leaders, teachers, whomever was willing to talk about it at that time. And then also families that had lost a loved one to suicide. And so just trying to understand what was happening in our community to best approach, the suicide prevention initiative. And so they did the qualitative interviews to understand, that it's going to take the community to address this. And in the 90s, when they started doing this, it was really hard for community members to talk about the deaths that had happened. We're raised not to talk about suicide, not to think about it. If you think about it, you're inviting it into your home, you're inviting it into, your family, to your friends, into the community. And so having those thoughts is not appropriate. And so being able to talk about it and also to feel that they were not doing something wrong. So they also met with the traditional healers so that the traditional healers could also share their perspective of what was happening in the community. So through that work, the tribe applied for funding and they were able to work with elders. Our elders were the first individuals to go out and serve as the case managers for suicide prevention from 1990 to about 1998. And that's when we saw a decrease in the suicidal behaviors in our community. And the elders were the ones that applied for those positions because our community members didn't feel confident enough to do that themselves. For us young people, we were not open to talking about suicide. Even saying the word suicide was really difficult. There's not a word in our language for it, either. And so as we continued to learn a little bit more about what was happening, the tribe was able to just have the elders meet with individuals who were struggling, listen to them, and sit with them for hours on end. And as they continued to do that, we still continued to see the decrease. They did not reapply for funding because they felt that they had taken care of what needed to be taken care of. And then in 2000, we saw a spike. 2001, we also saw the numbers increasing with the death by suicides. In 2001, our community members, if you can please proceed to the next slide. So in 2001 is when our tribal members, family and friends of individuals who had died by suicide went before our tribal leaders and demanded that something be done. And that's where the tribe passed a resolution mandating the reporting of all suicidal behaviors. 2002 is when the resolution was passed. In 2003 is when the tribe reached out to Johns Hopkins and asked if we could partner with them. And so in 2003 is when Francine started working on the suicide prevention program. She was served as the first case manager. We received funding to create our database so that we would be able to understand the trends that were happening in the community a little bit better and to try to be a little bit more proactive. And so, our registry is the first of its kind. And, we were the individuals who stepped up and started working on it. And I took over the Celebrating Life program in 2006. So if you could proceed to the next slide, please. So the tribal mandate that we have is very specific. So individuals who reside on the Fort Apache Indian Reservation are mandated, if they work or reside on the reservation, they are mandated to report suicidal behaviors to the Celebrating Life program. The Celebrating Life staff are mandated to refer all individuals who have specific behaviors to our local Apache Behavioral Health Services. If binge substance use is involved and they are 18 years of age and older, we are mandated to report them to our Rainbow Treatment, Substance Abuse Prevention, Intervention, and inpatient programs. And so, we have those mandates in place. And we work in partnership with the tribe. We oversee the Celebrating Life program. And, through that, we've learned, the amount of effort and work it takes and dedication to do the work that we're doing. Over the years, we've learned how hard it is, to talk to our community members, but they're the ones that actually taught us how to talk to everybody else. So when we first started working on the suicide prevention program, we did role plays. We learned how to address individuals who were struggling with the suicidal ideations, suicide attempts. If there was a death by suicide, we assisted with the families, and we still do, just talking with them, but not ever placing judgment, because we don't know what was going on, and we don't know what the individual's, last actions were. So we weren't there. It's between that person and the creator. Whatever they shared in their last moments, that doesn't pertain to us, and we're not there to judge the family, and we're there to support them. We also address non-suicidal self-injury individuals who cut, do, self-mutilation, and then binge substance use. And so we follow up with individuals, we do case management, we'll go back and continue to do wellness checks, provide transportation as needed. So there is a lot of work that happens when we're working on this. We're not just there collecting information, but we continue to offer support to our community members. Next slide, please. And through the registry, we have forms that we've created with the tribe and with the Indian Health Service. And so we do have a referral form, a case manager form, and our death by suicide form. And, through the work that we've been doing, at the beginning, we really struggled with the work. And so we had to figure out, how are we going to get support? So working with our tribal leaders, they identified that it's important for us to reach out to our elders. How can you guys get support from your elders? Reach out to them, let them know what you guys are doing, and that you are supported by the tribe, the tribal council, in doing the work that you're doing, what we've tasked you with. And so we reached out to our elders. We sent letters out to the elders inviting them to a meeting. We invited 25 of our elders that were identified by our health advisory board and our tribal council, and Indian Health Service, some of the employees that worked there as well. And so when we came together with our elders, we started to explain, this is what we've invited you to be a part of as an elder council member. And we shared that it's about suicide prevention. 20 of the elders remained that day, and 5 stepped down. The individuals that stepped down felt that this was a little bit too much out of their area of comfort, and they felt that they wouldn't be able to provide us with what we needed. So they excused themselves from the meeting, but we continued to work with the 20. From 20, it grew to 60. The elders served as a strong support for us. We also received permission from our elders to continue to do the work that we're doing, to be able to talk about suicide, so that we didn't feel that it was wrong. As we continued to struggle working on suicide, we talked with our elders. Our elders shared the work that we were doing was important, and that we needed to focus on life. You guys are not, in the work that you're doing, how you're trained, you're focusing on the death side of what you're not supposed to be doing. We need you to focus on the life side. We need you to focus on, how precious life is. We're going to celebrate this person. We want this person to know that they matter, that they, that we care about them, that they mean the world to us. They're a community member, so they matter to you as well. You need to be genuine when you're working with them. And so we started to do this with our community members. Working on suicide prevention is not going to ever get lighter, but it helped us to move forward and to shift our focus and to be able to grow and become a little bit stronger in what we were doing, and also to continue to develop our skill set. And as we worked with our elders shared that there's a disconnect between our elders and the youth, which we knew. And so our elders wanted to reconnect with the youth. What can we do to support that? What can we do to help the elders reconnect with our youth? And so we guided our elders back into the schools to connect with the youth. They wanted to talk to the youth about suicide prevention, but they didn't talk about suicide specifically. They talked about life. They talked about respecting their bodies, treating their bodies as a temple, treating it as if it was, treating it because it's sacred. And then also, not doing any harm to themselves or to anybody else. If you respect everyone, they'll respect you. And so the elders talked a lot about that. Also respecting the teachers, and the schools that we worked with, really appreciated the elders. And then the elders said, okay, there's not a consistency in what we're doing. There needs to be a little bit more of a consistency. So what we want to do next is we want to create a curriculum that we want to teach. And so we started working with our elders. It took us 4.5 years to develop a curriculum with them from scratch, but we did that. And so the elders now teach off of that curriculum, and we still go into the schools. Prior to the pandemic, and we were able to, have the elders teach. They were given an hour in the classroom, so we would be at 5 or 4 different schools, depending on, the schools and their schedules, and we would be able to go in and, the elders got a chance to do what they needed to do, talk about our tradition, our culture, prayer. And then some of the elders would open up in prayer in a public school. A lot of us know that's not allowed, but nobody's going to tell the elder that they can't, open with the prayer. So we were blessed to be sitting in those classrooms, listening to our elders, tell the students to stand and we're going to pray. And the teachers just love that. And so, our elders mean a lot to us, and they mean a lot to the program that we work on. And, they've guided us in so many ways. And so if you could please proceed to the next slide. And the model that we have here identifies that our program, our Celebrating Life program, is patient-centered. And so we receive a referral from different agencies throughout the reservation, through social media, or the individual themselves identifying that they're struggling with suicidal behaviors. Through that, we then focus on the individual we've received a referral on. We go and meet them where they're at, identify resources for them, take them to the different resources if needed. So we don't just identify the resources and say, okay, this is the agency, and then leave. We actually will offer transportation. If they need assistance with filling out applications, we're there to help them, guide them through filling it out, but not necessarily doing the paperwork ourselves. And so we've been able to support a lot of our community members. And with some of our community members for suicide prevention, when we've gone out and, searched for them throughout the reservation, we joke around with our staff saying, oh, you're NCIS, because we do a lot of investigating, trying to figure out where somebody lives, asking 1,000 questions, going from different home location to home location. Sometimes you pull up to the home location and then you honk the horn or you get off and knock the door. There's a dog sitting on the porch, the dog's wagging its tail. Obviously somebody's home, but nobody comes out. And then you'll see people peeking through the blinds or the curtains. Nobody comes out. So we're going to continue to try to find this person because we want to make sure that this person is safe. We also want this person to know that there are resources out there and there are people that care, and we want to be able to talk with them. And us talking to them, it does make a difference. And we do spend a lot of time with them. So there's no time restraint. There's no time limit on how long we're going to talk to someone. And from the time we receive a referral, we have 90 days to locate that person. So we're out there looking for them because we want to make sure that they know that people care and that there is support for them in the community. And so I'll go ahead and turn this over to Francine. So thank you so much.
If you can go ahead and go to the next slide. So I'm going to go over some data. We've been working on suicide prevention for many years. And so we were able to do a comparison between 2 time points. So from 2001 through 2006, you can see that our rate of suicide for White Mountain was at 40%. And because of all of the efforts our staff have done within the community, all of the educational awareness in services, one-on-one, case management follow-up, we had seen a decrease in from 2007 to 2012. And we went from 40% to 24.7%. What we saw from this time, so when I first started, we would receive annually about 250 referral forms. To date, we receive around 2,000 plus referral forms. But in 2007, we saw a shift. So prior to 2007, the majority of the referrals that came in were for attempts. And there was, a lower percentage of ideations. In 2007, we saw that shift where the attempt rate decreased and the ideation rate increased, not indicating that we had more referrals, but indicating that people were comfortable, knew that there was a reporting system and were reaching out prior to acting on their thoughts. And so, you can see the significance that we've had, the significant impact that we've had in the community. All of our staff's very hard work and dedication to our people has shown that, a surveillance system works. in-person follow-up works, and connecting with the individual on a one-on-one basis is primary because they're allowed to share with you what's going on with them and to confirm if the event is accurate or not, or what actually happened, because we could receive a referral that indicates ideations, but when you do the actual in-person follow-up with the individual, they share that it was an actual attempt. So next slide, please. So you can see how we are able to track the trends and the rates year by year based on males and females, and you can see that males and females attempt at the same rate. At one point, it was a little bit different, but now, you know, it's a 1-to-1 ratio, and it's been like that for many years. Next slide, please. So NIMH has funded our Southwest Hub, and so we have 4 community partners from other reservations and tribal communities. Dr. Mary Swick and Dr. Allison Barlow are the co-PIs for the grant. Next slide, please. So barriers observed in other communities, and so this is information that has been shared with us as we continue to support and guide other tribal communities in implementing a surveillance system similar to White Mountain. And so we know that there's stigma related to suicide. That was the same when we first started working on the suicide prevention efforts within our own community. Many do not have a tribal mandate. Like Novalene shared, we do. Some of the programs have been able to implement MOUs. A couple of the tribes have been able to also implement tribal mandates through tribal council resolution. Difficulty locating individuals, that's the same with us, because some individuals who are struggling with, you know, suicidal ideations or attempts also struggle with binge substance use, and so are very mobile and are hard to track down at times. Database support is a challenge for some because we are in rural areas and sometimes the web is not always the best. And then for some teams, there's, you know, safety during the home visits, and there's concerns about that just based on what's happening at the home location when, you know, you pull up to try to do a visit with someone. Next slide, please. So our partners are currently the Cherokee Nation Behavioral Health, and so they passed their tribal policy, suicide care. They have the mandate in place. They are creating and distributing their wellness resources and have trained case managers and community partners that they're working with. And we have gone and provided a lot of in-person training for them. They've have come to visit White Mountain, and we have gone to Cherokee to also support them and go out into the community to, you know, provide guidance and observe how they're doing their in-person follow-ups. We are also working with the Navajo Nation, and their program is called Honoring Life. And Navajo Nation is very large, and so there's, you know, Shiprock area is the primary area that is working on the suicide prevention efforts. They've been able to create MOUs with the schools. They do have case managers as well, and are adapting the intervention that we have, which is called New Hope. Next slide, please. San Carlos Apache Tribe, their program is called Life is Precious. They have ongoing surveillance, and San Carlos is one of the first tribes that we started working with. We were a part of their very first suicide coalition meeting, and so we were able to provide, you know, guidance on what we were doing here on White Mountain. they've been able to create art therapy and skateboard groups for their high-risk youth and adults, and different activities to engage the community. They also are working on a trail for the wellness of their people. So, a lot of different activities happening within the St. Carlos Apache tribe. And then the last tribe is Wallapai, Health, Education, and Wellness Center. And again, they have ongoing surveillance. They're utilizing the American Indian Life Skills sessions on Fridays with the teens, working with their different agencies. And we also did, go to Wallapai and have many meetings and presentations with their tribal council, first responders, healthcare workers, just to, emphasize the importance of suicide prevention and intervention, and really engaging with not just people who are, have made an attempt at the postvention, but right prevention, intervention, creating awareness so that you're able to engage with the community and get their feedback and understand what the struggles are within each population that they're serving. Next slide, please. So we have many interested communities and organizations, and you can see there's a really long list there. We have had either a conversation, a presentation, or have gone and provided training for each of these communities and organizations that are listed. Next slide, please. So that's our presentation. If we were to cover everything, it'd take us about 6 hours. This is just a snippet of what we do. There's lots more, but 20 minutes is not very long. But thank you.
Thank you, Novalene and Francine. Every time I've read or heard this story, I've been tremendously moved, and I think we've all been tremendously moved by your community and the work you've done. You've really shown us there are solutions, and you give us hope. We'd like to acknowledge your leadership and your community's leadership, and especially the community's humble approach to providing guidance and leadership on directions other communities might proceed. I'm encouraging people to use the portal in your chats if you'd like to submit questions. They're starting to come in. And I will begin with the question I asked the last presenter while we wait more to come in. And it's really the primary question. One of the primary questions of this workshop series is how can we change the trajectory of Indigenous suicide? There are many barriers, but if we do adopt strengths-based perspectives, what change do you see we could advocate for that would move uptake of celebrating life in other communities you're currently working in? I'll leave it to either of you, maybe both of you.
So I think based on what we've learned over the years and also providing guidance to other tribes on their suicide prevention work is making sure that the community is ready or willing to address suicide, and also meeting the community members where they're at. I think that our tribe, stepped up and did something that a lot of people at the beginning felt was wrong. And some people wanted to make us feel bad for the work that we were doing on addressing suicide prevention in our community, telling us that, what you guys are doing is inappropriate. You guys are violating the rights of your tribal members. And our tribe said, when this was presented to our tribal leader, the chairman at the time, our chairman said that it was important for us to, address suicide. All of our lives, we've been told that talking about it, is not okay, but not talking about it isn't helping the people who are dealing with it. and also trying to figure out how we can help individuals because there are underlying factors that lead them to having suicidal behaviors. For those of us that work on suicide prevention, it's a problem. It's a concern and it's an issue. For the individual struggling with suicide themselves, they found a solution. And so we had to look at it from that perspective in order for us to help our own community members, and then for us to turn around and try to help community members from other tribes address suicide in their community, understanding what they knew, trying to understand the barriers that they're faced with. Different tribes that we've gone to, we've spent weeks, on different reservations, trying to help them, in their own community where they're at. They come to our community and then we show them, this is what we do, this is how we do it. So we do hands-on training for different tribal members from different tribes, and then we go to their reservation so that we can see what they're faced with, and then we identify barriers on how we can help them. So that's what we've been doing, and we found that that's the most effective way on how we can support others to do the work that we're doing through our Celebrating Life program. I hope I answered your question.
Thank you. There was a question. A number of people are very interested in the elders curriculum and how it works, what they do, and they wonder if you could talk a little bit about what grades they speak to, what kind of topics they cover, and anything else that would be helpful for people to understand this work.
So the elders curriculum consists of 12 lessons, and it's one for each month. And for that month, we talk about, life in general. We talk about, different things that we can do to keep ourselves occupied. And so, for example, we're getting ready for our ceremonies, for the young girls. Some of the boys are going to go through their ceremonies, receive their names, participate in the sweat ceremonies. And so when an elder is teaching the curriculum that we've developed, they talk about respect. Respect is really important, and it resonated with all of our elders when we were putting together the curriculum. And so that's something that is mentioned at the beginning. Also prayer. And then we talk about the month. We also identify different words in Apache that we want the youth to learn. And then the youth are given a worksheet that they can go off of as the elders are teaching. And then as the elders share, when we're talking about, like the ceremonies, the specifics about our sunrise dance ceremony, or if, the families are getting ready to plant, what do the families need to do to get their fields ready for planting, if they're going to plant corn, if they're going to plant squash. So it's very detailed on what the elders are going to share. And then the elders share their stories, how they grew up, what it was like back then. And so, for example, when we, in November, because, they're also talking about Thanksgiving, being thankful, and the elders share as natives, we're thankful every day. We're thankful for life. You get up in the morning and you give thanks. When you're going to eat, you give thanks. Before you go to bed, you give thanks. And so the elders share that with our youth. And then the elders have also shared that when they were young, they were, there was no Thanksgiving. There wasn't where a lot of people came together and shared a meal and, shared what they were thankful for. She said, because, we're thankful every day, to be able to sit down with our families and have a meal. And so for them, it was different, how they grew up versus how we grew up now. And the curriculum that we've developed, we know that a lot of tribes are interested in what we've done. And so we do have the framework of what that would look like, how much, like we can break it down and explain what somebody would need to do to be able to implement something like this in their own community with their own elders. And then also in the schools, we went all the way down to 3rd grade and then all the way up to 9th grade in high school. The majority of the students that received the elders curriculum is 3rd through 8th grade. The high school was just a little bit harder. 9th grade, they got impatient. 8th grade, the same. 7th grade, also, they're learning to be set in their ways. 6th graders, we still were able to have a positive impact on them, with the students as well. So, thank you.